Hello, everyone, and welcome to our training on infection control standard precautions. Some of the key points that we're going to go over will be hand hygiene, how infections are spread, patient care equipment, how to protect yourself and the patient, needle sticks, injury, and disposing of those needles. What are standard precautions? Standard precautions are a set of infection control guidelines used to prevent transmission of diseases that can be acquired by contact with blood, body fluids, secretions, excretions, except for sweat, and mucous membranes that may contain transmissible pathogens. So here's a few examples of some of the bloodborne pathogens. This includes bacterial and viral infections and body fluids. So some of those are hepatitis B, hepatitis C, HIV, tears, which are body secretions, saliva, breast milk, vaginal secretions, tuberculosis, influenza virus, which is, of course, a viral infection, urine, semen, and COVID. We're not going to go too much into these. We're going to save that for another training, but I just wanted to include a little bit of them just to give you a little bit of context of what we're talking about. Does standard precautions apply to everyone? Yes, it does. It applies to everyone regardless of their diagnosis. So it doesn't matter if they have a diagnosis or not. This includes everyone. So you're supposed to treat everyone in every situation as if there's something going on. And what I mean by that is you're supposed to, wash your hands before and after, or sanitize before and after. Some elements of standard precautions: hygiene, hand hygiene. Again, we're going to talk about PPEs, safe, sharp disposal, patient care equipment, and cough etiquette. So hand hygiene is the most important aspect of standard precautions. So regularly washing your hands can help prevent the spread of a wide range of infectious diseases and illnesses. Healthcare workers must wash their hands before and after every patient interaction, as well as after any contact with blood, body fluids, or any contaminated surfaces. Now, sanitizing. Many people carry around hand sanitizer, which is, it's not a bad thing at all. I myself also always have some type of hand sanitizer on me. So just knowing when to use hand sanitizer and when to wash your hands. So washing your hand reduces illness in people with weakened immune systems by 58%. It also provides the greatest reduction in germs and reduces respiratory illnesses by 21%. Now, sanitizer. Now, if you notice that your hand is saturated in something like dirt, greasy, and it's visible, then you have to wash your hands. Sanitizing is not really going to help that, especially if it's visibly dirty and there's just grease and grime or whatever on your hands. Sanitizer can be very beneficial in water constrained environments. So there are places that where you don't have easy access to water. Hand sanitizer would definitely do the trick. I often use sanitizer even though I wash my hands and I have access to water. I still use sanitizer daily because we come into contact with all sorts of things in the healthcare field. We have packages that's coming in on a daily basis from UPS, FedEx, mail. They've been through multiple hands, so you don't know. You don't want to contract that, and the first thing we do is go to our face. So you want to make sure that you are thoroughly washing your hands. But just imagine if you're in an office or with a client, someone's at the door, they're dropping off a package. There's usually not a water fountain, or sink next to the door. So in that case, you put the package down, you do some hand sanitizer before you would touch anything else. PPEs. Now, what are PPEs? Anybody know what PPE stands for? PPE is the personal protective equipment, such as gloves. So gloves we use, of course, when we're touching like body fluids. We come in contact with intact skin. Gowns are standard protocol for if you're doing procedures, of course, but this can also be just to protect yourself and protect your skin, protect your clothing from whatever you're doing when you're working with the patient. So if you're doing a wound care, if you are messing with some exposed skin that contains, surface of body fluids, secretions, or anything like that, gowns are really good to wear. Also, the gloves. We use gloves when we come into anything that can be contaminated, especially if we're going to be touching any type of mucous membranes or anything. Mask, of course, to protect others and to protect ourselves. So we use this in instances where we're engaging in activities that will likely generate some type of splashing or sprays of any type of secretions or body fluids. Also, the shield. I hadn't seen the shield that much. I know that whenever they're doing procedures, like in the hospital, they use a lot of the shields, but I've been seeing them more and more just with regular lay people ever since COVID. I know that masks were kind of scarce at one point, and so they were offering the face shield. So that's also a good way to protect yourself. Goggles. The goggles also, because you don't want that getting into your eye. Remember, you have blood vessels and mucous membranes in your eyes. So it's an open cavity. So you don't want anything splashing in there. So anytime you're dealing with something, especially skin that has been broken, so like any type of wound or like abscess, a cyst, or anything like that, you want to make sure you're wearing your PPE, your personal protective equipment, especially goggles. Also, what's not pictured here is a head cover. So you'd be surprised how much stuff just splashes in our head, and that can also get and cause some type of infection. So you want to make sure you have that type of PPE to cover your head. Also, shoe covers. Whenever I'm doing clinical rotations, I have this routine that I do. And, a lot of people say, oh, you're going to get tired. It's going to get tiresome. But no, if you have been practicing this and you have your own routine and you've been doing it for a while, then, and you know that it protects you or and going to protect others, then you're going to stick to it. So I have this routine. Every time I come from the hospital, I have something set up in the garage. I spray myself down. I have something that I put my shoes on before bringing them in the house. I kind of spray them and I let them kind of dry overnight. There's shoe covers also. Now, I don't have the shoe covers because I think that it's not something that should be worn for hours and hours, because I'm not sure about the grip. I've only had to wear those when we go into the surgical rooms. But wearing shoe covers or making sure that you don't bring those extra germs from wherever you are into your home would be something that you should very much think about. So if you can have a little area, let's say you're working with the patient, you can have a little area before you enter your house and bring those germs in. Maybe have a little station set up, like some spray or something that you can kind of spray yourself down, or take off your shoes and put it in a designated area, so that you won't be bringing all those microorganisms and those pathogens into your personal space. Next up is needle sticks. So we're going to talk about needle sticks and disposing of these needles properly. So you may be doing a needle. This is one of the number one ways that a lot of people end up contracting something, or maybe getting a scare. Never recap the needle. You should never, ever, ever recap the needle. You can properly dispose of them. There are some needles that have the safety lock on there already, so as soon as you inject the patient, it snaps and it sucks the needle in completely back into the syringe, and you don't see anything, which is 100% safer than you trying to recap a needle. There's also some needles, like I said, with the safety lock. So when you give the injection, once you take it out, you use your thumb opposite of the side of the needle to pop that cap, and it's going to lock it in place, and you cannot open it again. Once it's locked, it's locked. But you should never, ever take your whatever needle, whatever hand you are holding that needle in to inject that patient, never take your other hand and try to recap that needle. That is a big no-no, and that's how you can definitely get needle sticks. And it's a whole lot of paperwork that you don't even want to deal with. You have to file an incident report. You may have to do blood work in 3 months, then again in 6 months, then again in 6 more months, then again in a year, just to make sure that nothing has developed. No, just don't recap the needles at all. Next, we'll talk about the sharps container. Next, we'll talk about how to dispose of those needles. So this is a sharps container. You're going to dispose of the needles immediately after use in a puncture-proof container. Do not place sharps on environmental surfaces where kids can get to it easily. So you don't want to place this next to, like your kitchen stuff, or, where you're eating or anything like that. Once the sharps container is full, like maybe 3/4 full, then you want to make sure you close it. Now, I've been around some patients who unfortunately didn't have a sharps container. So you might ask, well, what do we use? What if the patient does not have a sharps container? Well, I recommend you use something that's not so easy to puncture with a little needle, which would be like a Coke bottle, a sturdy water bottle, or anything like that, a can or something that can be closed, like with the lid when you're done, that you can dispose of. So I had this client that I was working with who did not have a sharps container. We were doing her insulin and teaching injections, and all she had was actually she had a Coke bottle, or some type of some type of hard surface bottle that can be easily capped. And she ended up having a Coke bottle that she had just finished drinking a Coke, and the needle was able to fit through the top of the hole. So we disposed of them in there, topped it up, and then we were able to dispose of it properly. So if it's a puncture proof container, something that's not easily punctured, then that's another thing that they can use if they don't have a sharps container at home. Another thing I want to mention, you should never reuse needles, never reuse lancets. Always make sure that you get a fresh one. You never want to administer medications from the same syringe to more than one patient, of course. Even if the needle is changed, you never want to use the same needle to administer medications to multiple patients. You never want to use the same syringe to administer medications to multiple patients. I know you're probably thinking, why would I do that? But some things have to be said. You have no idea of the things that go through people's mind when they're running low on something. So yeah, it actually happens a little more often than normal, especially if you're in a household with multiple people. I have seen people share their lancets when they're running low, and I had to kind of do a teaching and let them know the risk, that they're taking with that. And then it's kind of like an eye-opening moment. But yeah, some things have to be said. Next is respiratory and cough etiquette. Believe it or not, there are people that still do not know the proper way to conceal themselves when they're coughing, especially out in public. So you want to make sure you do your teaching with them and show them how to cover their mouths and their noses when coughing or sneezing. They should be using disposable tissues. Yes, people are still old school. Some people, they use handkerchiefs or some type of cloth that they continue to use. It's saturated already, but they will continue to use it, and then they go out and they touch everything else. Make sure that they're using a tissue or something to cough in, and then they dispose of that properly. Teach them how to perform their hand hygiene. So if their hands have been in contact with the respiratory secretions, make sure that they are washing their hands properly or sanitizing their hands properly. You can see at the picture at the top how the droplets can travel. You may not see it. It's showing clear here on the black background, but you may not see it out in public, but those droplets travel every time you cough. And then you see an example of how to properly cough, like in the fold of your elbow. All patient care equipment must be cleaned at all times. So after each use, you want to make sure the equipment is cleaned properly, especially if it's soiled with blood or any type of body fluids or secretions. It should be handled in a manner that will prevent the skin mucous membranes from being exposed. Wear your proper PPE, like your gloves, gown, according to what type of level of contamination when handling patient care equipment. So if you're checking their temperature, of course you want to make sure that you're using a probe cover or something over it. If you don't have any probe covers, then that thermometer must be for that patient only, specific, and it must be cleaned properly between each use. Your stethoscope, whenever you're doing blood pressure, I do not see a lot of people that do this, but please make sure that you are properly sanitizing your stethoscope each time you check their blood pressure or listen to their heart, lung sounds. That's coming into contact with their skin. You don't know what kind of microbes can be on their skin. So make sure you're using like an alcohol wipe or something that you can clean it in between use with different patients. Also, the little pulse ox device. where they put their finger in to check their oxygen in their blood. Make sure that you are properly cleaning that in between the patient use. The blood pressure cuff, all of this should be cleaned properly. You can wipe it down or spray it or something like that, but just make sure that you're cleaning it in between use. What are some ways to prevent being contaminated with an infectious agent? We're going to wash our hands with soap and water thoroughly and often. Another way, we can avoid touching your eyes, nose, or mouth with unwashed hands. Avoid close contact with sick people, those with fever, cough. You can also avoid hugging, avoid kissing. Even with your partners, you want to make sure you avoid hugging, avoid kissing, avoid shaking hands with anyone in the public or greeting, especially if you know that there may be a known something that's going around, and if you don't have sanitizer readily available. If you know that you're sick, please stay out of people's faces. It's the bottom line. If you know you're sick, stay home. If you have to get out, of course, cover up. Use your precautions, stay your distance, keep sanitizer on hand, wear your mask. No hugging, no kissing, no touching, no greeting, no shaking hands or anything like that. And then we're going to talk about good, healthy eating habits, like your overall well-being. So getting the proper amount of sleep, because you want to make sure your immune system is as strong as it can be. Getting the proper amount of sleep, eating, keeping physically fit. There is a really, really strong connection between the immune system and your nutrition. So making sure you have a well-balanced diet, like your sleep pattern is good, making sure you exercise and things like that. When people think about like their immune system, they usually don't consider how important or what the role it actually plays in fighting off infections and other, common colds and things like that. So there is a great connection between the immune system and nutrition. And one of the most effective ways to fight against viral infections and things like that is to build your immune system up. So proper sleeping, proper eating, incorporating vitamins and nutrients, cleaning out your gut, focusing on gut health, like taking your probiotics, prebiotics, and things like that. Omega-3 fatty acids. Those things are really good as well. I won't go too deep into it. I'll save that for a different lecture, but building up your immune system is very important, and it plays a really big role into, preventing, things from attacking our immune system and causing us to have those viral or bacterial infections and things like that. So I hope this was helpful. If you have any questions, my email is listed below, and you have a wonderful day. Thank you.